Thank you, Aaron. I'm thrilled to be here with the data science team to talk about coming back to work landscape using data science. So I invite you all to go to tibco.com/COVID-19 and open up the Spotfire live report and follow along in today's webinar. We're going to do some basics to set up the presentation. We're going to do a number of demonstrations, and then we'll do a rejoinder around applications of reopening to different industry sectors. The panel, Neil on visual and geoanalytics, Prem on visual data science, Mike, industry analyst there looking bad with the mask, and myself. So our motivation here is to provide a data-driven review of issues from a data science and epidemiology, data journalism perspective. To make a contribution to the community, we're providing our curated data, Spotfire apps, R and Python code, along with our global intervention timelines, and a visual data science perspective, recognizing the many sources of variability and getting signal from noise. You'll see TIBCO products at work, visual and geospatial analytics, data science, data prep, data wrangling, streaming, and the TIBCO Connected Intelligence Cloud. We are motivated by this group, Scientists to Stop COVID, who are working towards a number of initiatives, repurposing drugs, developing antibody therapies, creating and supporting vaccine development, and really restoring our society and economy, which is where we come in. So where do we stand at the moment? Well, as of today, we're more than 10 million cases worldwide, more than 500,000 deaths. There's hotspots emerging in a variety of places around the world. In the US, we're at 2.5 million cases, 120,000 deaths. You can see this sort of cubic-shaped curve in the cases with the recent June data almost paralleling the rise that we had in March. You'll see in the analysis our techniques for developing hotspots, and basically all you have to do as a user is click this little circle, lasso an area on the map, and the hotspot analysis will occur. In conjunction with those markings, you'll get a case curve, epidemic curve. You'll see which counties are trending the most. You'll get updates to all the rest of the statistics and summaries, on the application. As you scroll down, you'll see the US Southeast and case velocities that we're calculating by fitting super smoother estimates at the county level, and the darker red indicates an upward case velocity, which we're seeing predominant in the Southeast and also in the Sun Belt. You can also normalize the cases to look at cases per 100,000 at the county level. We were predicting these spikes to occur for some time. If you think about the reproduction number, which is the basic reproduction number, the number of people infected from an infected person, under usual conditions, the effective reproduction number, is that reproduction, in the presence of interventions. You want to keep that below 1, and you'll see in our analysis today how that has been jumping above 1 in the last, since Memorial Day in the US and in, other hotspots around the world. So we were predicting the outbreaks in Arizona and Florida and Texas, a few weeks ago, and now we're seeing them show up in the case counts from the projections that we're estimating by predicting the effective reproduction number over time. We're going to get into a little bit of how this data and these analyses are relevant in the back to work scenario. In terms of healthcare analytics, analytics centers have become command and control centers for hospitals, doing things like supply chain prediction, fulfillment, managing financial performance and operations with telehealth emerging, predicting occupancy and demand, predicting bed demand. We've created models for predicting requirements for beds and ICUs, and supply chain analysis is pretty significant. On the consumer goods and retail side, predicting the business with the lack of in-store sales, store reopening, comparative analyses, e-commerce and in-store revenue, trade area, forecasting and nearcasting demand and revenues, and how to re-optimize media spend optimization. So with that, I'm going to hand off to Neil to give the first demonstration around hotspots, reproduction numbers, interventions and mobility. Neil?
All right, so so the analysis I'm going to show today you can access by going to tibco.com/COVID-19, and you can open the Spotfire COVID-19 app, and that'll take you to this live report, which is updated a few times per day. And this live report has a few different things we're going to go over today in the context of where the disease is spreading and back to work consideration. So as you scroll down, you'll see these different analyses. You have effective reproduction estimates, which we'll go through today, some government interventions and their effects, hotspots. There are some live data streaming, some real-time flights coming in. There are growth trajectories, healthcare resources, and so on. So there's a lot of stuff in here, and we're going to just go over the first couple. So by going to the world countries, you'll first see kind of an overview of where things are today. That's just the global landscape. And by selecting any country, you'll be able to see our super smoother here, which is a localized bivariate regression method that is making predictions along all of these points. And over here, we see these curves for the United States, and I've seen a lot of moving averages kind of coming around out there. The super smoother has a benefit of actually not having a time shift and lag, and actually provides a much more accurate smoothing of the case curve. So this is a foundation of a lot of the other calculations we do, because as Johns Hopkins has said themselves, the reporting is consistently inconsistent around the world. And so we need to have a better way of measuring the true epidemic curves. So the first page is just showing a country level overview, but you can go on to states and provinces. And here you can see the United States. Of course, you also see a case rate, which is the daily rate at which things are getting better or worse in each state. And this is calculated off of that super smoother. And we also have these per capita counts as well. So you can see the amount of strain a certain population is under. It's a little more population normalized. Now, we're proud to say that we have quite a few countries in here. I think for many of the dashboards out there, they typically focus on one country or a couple countries. But we have actually gone through and pulled from different governments, local states, and provinces, and showing the individual provinces for certain countries. So here's Brazil. As we know, we've probably seen the news that Brazil has been increasing quite a bit, and we can see that things are maybe starting to slow a little bit for Brazil, at least in the past few days of reporting. So you can see Brazil here. You also get a chance to see India, which has also been high on the radar from the standpoint of having a lot of growing cases. So India's on here, as well as many European countries and other Asian countries. Now, on any one of these pages, you can also switch between cases and deaths. These will show by cases by default. And you can also change the timeline if you'd like to see how things have changed over time. Before cases were reported, when cases started being reported, as they progressed throughout the country over time. Now, in the US, we have a little bit more data that goes to a more granular level. And this is showing by individual counties. And we know that the Southeast has been kind of blowing up lately, been a little bit warmer with cases. And you can also select any region you want. And what this is going to do is actually aggregate that region of whatever counties you select and show you an aggregate of that on this epidemic curve. Now, this is beneficial in the sense that, you know, certain counties may not be reporting as much, or you might get some variance between geographical regions, but by aggregating this and selecting certain regions, you can kind of get the true spread of those areas. And as you select that, you'll also see that these hotspots are calculated. And these hotspots, let's go ahead here. Let me get my pan here. These hotspots are calculated using a Loess smoother at adaptive spans for each individual area. So the more points you select, the spans will actually adjust to give you the hotspot. So if we actually rewind this back to, let's say, maybe mid-April and allow this to calculate, you'll see that the hotspots in mid-April around New Orleans. We're starting to see some stuff in Atlanta, Dallas, and Houston. But as things have progressed to today, you can actually see that this has really spread into the rural areas and the big cities. You know, Houston has really become more alarming, but also just the rural areas have come up. So if you go down here, you will see the rates. This kind of looks a little checkered, but what this is showing is the individual counties. Where is it getting better or worse? It's not to say it's not bad or it's not good. It's just, is it getting better or worse? So it's a first time derivative again of that super smoother. And going down here, you'll see the actual individual states and counties at a population normalized level. I just moved this hierarchy down to just the state level. This is showing the highest counts per 100,000, highest cases. So if I wanted to see maybe the top 5 states, I can select those. These are the top 5 states with cases per 100,000. So moving on to looking into the future at where these cases might be going, we have effective reproduction estimates, and these are the number of people, as Michael was mentioning, the number of people that one person will infect on average if they have the disease. So if this is 2, then one person is going to infect 2 people. Those will go on to infect 4. Those will go on to infect 16, so on. So you need this number to be below 1 in order for the disease to diminish. So this calculation we have on individual country levels. So you can see here for Europe, things are going a little bit better here. Still, the latest estimates for all of this averages to 1.1. So it is still increasing. You can go ahead and search for South America as well. And we can see how different parts of South America are, which recently has been, again, increasing. So Chile, which is actually very high in cases per capita, looks like it's starting to potentially slow down here, while other areas are more of these darker blues. So they're increasing, Paraguay being notable there. You can switch this to also the states and provinces. So here is the individual states of Brazil as I go a little bit deeper here. And we can see these reproduction numbers as they're going up and down. We want it to be below this line into the green zone there. So this is a little exploration. You can see the 24-hour change to see just where things are getting better or worse in the context of reproduction estimates. And you can also adjust this for a more scientific view, the serial interval, which is the mean number of days between the onset of symptoms starting to show an infectee from an infector. And this number is still being determined by researchers. So this allows you to kind of play with those numbers and recalculate if you'd like. So moving on to how these governments are actually taking action here. So we'll go to government interventions, and we have for world countries, let's go here to world countries. So we've seen many different countries approaching this very differently. So if I go down, for instance, to the Netherlands has been progressively reopening without really having enforced restrictions. The numbers are still a little low after a small case increase, and they're kind of under control. Primary schools have been back to full capacity. We saw that in the United Kingdom and in England, that hospitality has recently reopened. They're still awaiting quarantine rules to be lifted and non-essential travel. But most children are not returning to school until September. So you can see this timeline of these interventions in this table, which is generated with an ARIA NLG extension for Spotfire to actually generate some of this text and explain what is happening there. Iran is also very notable. Iran has a second wave. So Iran has increased measures or released certain restrictive measures, including places of worship. And then we also saw, and that is actually all logged in here. But now we're also seeing a second wave here. So quite a different curve than what we're seeing in other parts of the world. So a lot to look through here. The US states gives a little bit more detail. So Washington, where I'm based out of, Seattle, we've been pretty locked down since early March, and you can see, you know, Washington over the state is still starting to increase. They lifted the stay-at-home order right here in late May. Meanwhile, however, Texas, you know, so Washington was able to kind of flatten things out and bring it down. Meanwhile, Texas didn't really have much of a restriction. They had a stay-at-home order on April 2nd, and they lifted that just a few weeks later, about 3 weeks later. And so in Texas, we're seeing a lot more increase there. And that goes even more into the US cities. You can see up here at the top right, I'm changing the geo level. So Houston had taken its own precautions, but lifted these pretty early in around early May, late April, has seen a big increase. Whereas Seattle, where I'm from specifically here, has been a little bit different, a little bit flat, but we're ticking up now. So moving on now into just the context of business reopening. Let's see, 1 second here. Moving on now to the context of business reopening. So I went to this page. It's one of the first analyses on the cover page, and there's a lot to go through here. There's a lot of different considerations, a lot of different parameters. So the first thing it's going to show is the cases per 100,000 for New York, which we've already kind of seen on the other page. We can kind of cycle through this and jump through time to see how cases per 100,000 were in April, May, June, and how they are today. We can see those case growth rates, which we also showed on the other page. But we can go a little bit deeper now and look at things like resident mobility. So residential mobility is how much people are staying at home, and workplace mobility is how much they're going to work, and maybe how many businesses are actually open physically. So in March, you know, this was all pretty flat. This was all close to its baseline of the workplace mobility. But by April, this had really shut down. People had stopped going to work completely. May, it started increasing a little bit, not quite. And then in June and now, this mobility has really increased for workplaces. But just because people are not going to work does not mean they are staying home. They could still be going to parks and bars and restaurants. So that's why the residential mobility is also good to look at in this context. Reproduction number is also available to look at here at the county level. Every one of these can be drilled into on an individual county, and you can see how those reproduction numbers are trending over time. Unemployment rate has also been added. So this is updated from the Bureau of Labor Statistics whenever they provide new data. The last data they had as of yesterday posted at the county level was in for the month of April. But we can see here, we can actually switch to the national level, and we can see that there is quite a bit of unemployment in the Midwest. We can see parts where this is affected. So we can see how this changed from March and into April. You can go on, and I'm gonna not go into too much detail here, so let's go hospitalized. I'm not gonna go into much detail here because we have another presentation that I'll go into more of these reopening. But you can look at other things like statewide metrics, like the amount hospitalized from COVID, the testing capacity per state, things like that. So one last thing I will show you before handing back to Michael is the real-time flights. Now, we'll have to see what flights are coming in. We have 4 radio receivers all around the world. We have them at 4 TIBCO offices. So we have one in Boston here. We're seeing real-time flights coming around Boston. And why are we showing real-time flights? Well, we had actually already set up this project on looking at different flights around the world for a separate project. And we noticed that as we were tracking this, you could totally see the flights dropping in March. This is in New York, London, Gothenburg, Sweden, and Boston. So just a total drop off there, indicating that there was a lot less air travel in these areas. Again, we're picking this up off live radio receivers in the area, just whatever's around the TIBCO offices in these cities. And looking at just kind of these traffic trends, we can see that things are starting to tick back up here. So you can see kind of, you know, Boston and is ticking back up here, and the flights. So this is something that we'll kind of continue to monitor, and maybe we'll put some forecasting on. But for now, you can kind of explore to see how the infection might be spreading from international travelers from vastly different regions, or if these regions are fairly locked down to their own local populations. All right, Michael, I'll hand it back to you.
In fact, let's hand it off to Prem, and let's look at more specifically in California, the criteria for reopening and how we're tracking those metrics and predicting, you know, at the county level, you know, the reopening criteria. Prem, would you take us into the California analysis now?
Sure, Michael, thanks. Let me share my screen. All right. So as Neil mentioned, how we are trying to track business reopening and how we're looking at different metrics. Some states like California, Washington, and New York have come up with their own thresholds to define what phases they want to bring counties into. And I'll go through that as we speak. Right now, this is a back-to-work dashboard that we made. For the first page, gives you an overview of how things are looking in different counties in a particular state. This is particular to California here. You can see that Los Angeles has the bulk of the cases. It's 100,000 approximately at this state. And you know, it's growing at a fast pace as well. That can give you, this page gives you an idea of how things are doing right now. And you can go into interventions in particular metro areas. In California, we have San Francisco and Los Angeles. And you can see how cases have been growing since they've, you know, lifted the non-essential shops closer. And in fact, 1 or 2 days ago, Los Angeles decided that they want to close down bars again. So they retracted on their statement to like open non-essential shops because the cases were growing at a much faster rate than they were growing before. You can see San Francisco also on a steep curve, much more than they were growing in the early March onset. And that happened after they started lifting some of their closures like hospitality, non-essential shops, and no mass events, etc. Coming on to the business reopening criteria, what California has done, the California Department of Public Health has defined some metrics and thresholds for them. So for example, the first metric they've defined is cases per 100,000 people. And the threshold for them is that in the past 2 weeks, there should be less than 25 new cases every day for any county to pass that particular metric. So you can see that overall in California, it's at 9.4. So it looks good, but if you drill down into some of the counties, it's bad in some of them, and you can see that this county doesn't pass the threshold. For example, LA County, you can go to, it's at 19.2 currently, but at the same time, it's growing as well. So this can easily pass 25 in the coming days. They also define how they look at single-day hospitalizations. So there should not be more than 20 hospitalizations on any single day in the past 2 weeks, which on an average in California is at 67, which is a high number. And the bulk of that is coming from LA, which has approximately 1,556 hospitalizations on a single day, which is high. They also have metrics defined for positive test percentage, where they want to keep the positive test percentage from any county down to less than 8%. Overall, it's at 3.8%, so it looks good, but some counties are performing very good. Like some of these are in Northern California, and some of these in Southern California near LA and San Diego are worse in number. We can also look at reproduction numbers as to give an example of a threshold. So anything less than 1.0 means that the disease is not spreading, but something more than that means the disease is spreading. So you can see that even though the positive test percentages in Northern California were much less, the reproduction numbers are generally higher in that area, which means that there might be an uptick in the positive test percentages and the cases per 100,000 metrics in the coming few days. This whole dashboard or this page gives you an idea of how each county is doing in terms of kind of reopening, and what California has done and what even Washington and New York are doing is based on how many metrics are passed for each county, they define a phase that they can move into. So for example, phase 1 is the most restrictive and phase 4 is the most lenient. And depending on how many thresholds you pass, they move counties into different phases. And that's how you can, use this dashboard to look at how your county is doing. We'll be definitely bringing up more states and more countries as we can get more data on reopening as well. And coming on to testing in hospital locations. So for different counties in California, we collected testing in hospital locations with bed capacity and number of staffed beds that were sourced from Definitive Healthcare. And what you can do is you can search through different counties. Let's select one here. Let's select San Francisco, maybe. There you go. You can see that you have a lot of hospitals in the area. You also have testing sites, and we also have a distance metric that's calculated from the center point of the county. So you can see that these are the nearest hospitals from the center point of San Francisco. There's 2 testing sites available, and you can also look at where it's available, of course, data from number of staffed beds, utilizations, etc. And you can look at metrics for each hospital for the same as well. You can go through different counties and look at how many testing sites they have. You can also filter on to only testing sites, and you can see that there's 4 testing centers in Santa Clara. You have your addresses and you have distances from the center of the county. So this page can also help you kind of figure out how hospitals are doing in terms of bed capacity usage, and also how many testing sites are present in a particular county and where are they as well. I'll bring it back to Michael.
Terrific. Yeah, great demo there, Prem. And we're following closely these stages of reopening in California, where we live in the West Coast, so we're tracking this pretty closely. Okay, so Prem showed the hospital locations and testing locations. In the actual live report application, we have the ability to do drive distances. Prem alluded to this. So here I am in New York. If I were to say click here in Upper Manhattan, right click, I can copy those map coordinates, and then I can paste them in here, and I can find nearby resources to where my location that I just chose is. I've got a drive distance here of 3 miles. I could drop that down to some other number. I could click over here in the Bronx or Brooklyn. Grab a new coordinate. Paste that into the application, and Spotfire will immediately figure out this trade area or driving distance from the start location, going out at a driving distance of 2 miles, taking into account the road patterns and so on, to show the testing facilities and hospitals that are in that location. Now I'm going to segue now into some vertical industry applications in the back to work landscape. That's a good setup for that, because as you're trying to figure out, say for example, forecast demand of a particular product in a region, you might have some distribution centers, some stores that you're trying to serve. You might be doing some promotions into those stores, trade fund spend type scenarios. You might be figuring out how the forecasting the promotions. And then what I was going to get to now is the routing. So if I were to have a certain number of deliveries that I want to make from a distribution center out to my stores, and I only have a certain maximum allowable deliveries to make any particular day. You see that San Jose's got too many deliveries that it can't handle. How do I spread the deliveries around? How do I optimize the assignments of deliveries from different distribution centers out to these different stores who need to get the coffee? And you can see how the San Jose is cut back to 50 deliveries, which is the maximum allowable. And we've optimized the routes to deliver to the stores from the other distribution centers. So what you've seen from Prem and Neil, a bit of a recap here. You saw local hotspots, the hotspot analysis in the Southeast and the Sun Belt. We've also seen that happening around the world. Apparently in Lisbon, there's hotspots there that are occurring from people partying too much, it sounds like. You see India and Brazil on a tear. And we do have some concerns going into the summer and holiday season, around the world from the analyses that you just saw. You saw that we're able to predict those hotspots, though, from these reproduction number estimates that we're able to do from the case counts and fatalities. The virus is very efficient to reproduce and spread. These predictions that we're doing of the reproduction number are a leading indicator for cases and fatalities. You saw that the way Governor Cuomo got New York down, he was managing to an effective reproduction number of 0.8. We were in communication with him actually about that. And the other states that you saw spiking up above 1, that is a harbinger for bad things to happen. And that's what's happened since Memorial Day. And you saw that in the analysis that Neil presented. We've added, local government actions, including annotations and natural language right there on the graphics. Testing and mobility, and Neil showed also the airport level analyses, and Prem just did a fantastic job of showing all the criteria that are being tracked at the county level in California as we do the reopenings. So some of the things you saw in the analysis, that are key to the analysis. Firstly, this hotspot analysis, originally developed by Peter Shaw on the data science team. It does a lower smooth with adaptive bandwidths. The smaller areas get wider spans. Contours and heat maps are estimated on a pretty fine grid. And so the bottom line is you get this smearing of around the center of the activity. And these functions are available from the TIBCO community to download and add to your own analyses. We use the EpiEstim package to predict and estimate the reproduction number. This is developed by Ann Corey, and it incorporates uncertainty in the distribution of the serial interval, which is the distance between the onset of symptoms in a primary case and symptoms in a secondary case. There's 5 different methods in the EpiEstim package for doing the estimation, parametric, and so on. Number of things here. We use the method 2. With uncertain serial interval with mean standard deviation that we've developed based on research done by people like Tim Churches and Sam, at the in the UK. There's a number of folks working on this stuff. The kind of the key seminal papers from Anne and colleagues at Imperial College, as well as Jarko and Peter. One of the original papers that we reference. And then the super smoother that Neil mentioned, that Neil has developed, standing on the shoulders of Jerry Friedman, of course, this really deals with artifacts in noisy case report data. So oftentimes regions will report more cases on weekdays than weekends. They're noisy, and smoothing out the epidemic curves is really useful in showing trends. And we're getting first derivatives off the super smoother curves to provide case velocities. And we're able to, in those analyses, generate natural language to show off what's been happening in interventions from local governments. And applying marking on Spotfire kicks all of this off. So it's just right there. The algorithms are right there under the mouse for you. As you click and mark, you're getting those fit directly on the data pretty fast. So how do these techniques and what you've seen today apply to different industry sectors? So in the consumer goods and retail sector, it's really accelerated the move to digital and online analyses. You've seen this use case, BOPUS, buy online, pick up in store, has grown more than 500%, and sales have been soaring at Walmart and Home Depot, as well as Amazon. And COVID-19 has helped Walmart actually make up ground against Amazon. There's more places to pick up, more Walmart stores than Amazon stores. So this BOPUS use case is effective for Walmart. On the other end of the spectrum, Microsoft just announced they're permanently closing all of their retail stores. And our colleagues at Procter & Gamble, can't make enough toilet paper to sell all the toilet paper they can manufacture at this point in time. So really some dynamic shifts in the consumer goods and retail analytics area. We're engaged with our customers to help them predict the business. Very difficult to do that when you don't have in-store sales, and your historical way of predicting the business is to do month over month, quarter over quarter sales of the same store, and you don't have any store level sales. So we're doing comparative analyses to look at the effects of store location, local COVID status, product mix, the type of store, is it indoor, outdoor mall, on the street, what's the best way to reopen, looking at e-commerce and in-store revenue data, trying to understand the effects of the combination of e-commerce and in-store. You know, is it a halo effect or is it cannibalization? And then looking at things like media spend optimization. You know, a lot of folks are starting to buy ads on popular channels at the moment, like Hulu, versus traditional media spend. You know, on the healthcare side, working closely with our partner company, Syntellis, and really what we're seeing here is hospital leaders are requiring near real-time analysis to manage operations during COVID-19. And our visual analytics and data science tools are really helping to optimize the business and provide insights, you know, all the way down to the point of care. So we're predicting bed demand. We're doing supply chain prediction and fulfillment, managing financial operations, big resurgence of telehealth, and monitoring occupancy and demand. Now, we've been working closely with our partners, Definitive, Syntellis, Kaufman Hall, to look at projecting inpatient beds as a function of age and location, and understanding various model parameters. You can set the effective reproduction number in multiple stages over time, and fit your data from that and project into the future based on the population demographics that you have in the region, the catchment area for that particular hospital. Now, this is originally based on work from Christian Altus's group in Switzerland, and data is coming from the AHA and the CDC, and we have inspiration from other folks who are trying to predict these sorts of things. We're using a multi-compartment model in this case. Some of our partners are doing some pretty amazing things. It's really fantastic to see the genome of SARS-CoV-2 inside of Spotfire. You can cruise along the genome location. You can rotate the model, the protein structure. Explore the 3D model of that. Understand patterns and mutations as the virus has progressed around the world. You can also look at the physical properties of potential drug compounds based on their bioactivity, and figure out which compounds are being targeted for the virus based on different properties of that they may have, and basically look at a structure activity type analysis. We're also keeping a track of that website I showed earlier, the Milken Institute site, tracking different clinical trial information based on therapies that are being explored, and viewing specific trials. All of these analyses are fairly straightforward to do inside of Spotfire, and we have a number of webinars going on with our partner PerkinElmer in that area that are digging into that. Now, in terms of back to work planning, there's been a lot of activity here in terms of digital apps for symptom tracking and contact tracing. Some of the data we showed you today, we're getting from Google Android devices, and Google and Apple are both bringing to market this idea of contact tracing, which has been going on for a while in places like Singapore. Now, we've built our own application for symptom tracking, and we're calling it GatherSmart. It's coming under the TIBCO for Good banner, just like our Spotfire Live report. It's in beta at the moment. It's going to become available in July. We're making it free of charge for employers that have a small number of employees, I think less than 50. And above that, we're just recouping costs. So it really is a TIBCO for Good initiative. The way it works is you have a mobile app and a control center. The control center, you can apply symptom surveys out to the devices of the employees or the students. They answer some questions. You figure out based on whatever rules you want to apply or algorithm you want to apply to the data determined by the employer or the school administrator, whether or not to give a digital passport for somebody to come into the facility or not. And then you have a control center web application that allows, again, based on Spotfire, that allows you to monitor and manage employees through or students through a centralized dashboard. So it's that kind of three-step process. Set up the survey, send it out, people answer it, they get accepted or not to come into the building, and you monitor that from the control center. The surveys are completely configurable. This is some screens from the beta, which is out there at the moment. You can figure out what questions you want to ask, define the survey, figure out the rules that you want to apply for letting someone come in the office or come to school. There's an example here, for example, using the CDC type approach. Do you have 2 or more of these symptoms, or have you had contact with an infected person, or have you had a positive test? Various ways that you can set up the survey for folks to stay at home versus come back into the office. There's a lot of activity in this area. We're closely following that, and the people who sign up for Gather Smart have complete flexibility over how they want to configure their surveys. And the test, trace, isolate piece, these are all customizations in terms of tracing people that show up as having symptoms, having a positive test result. The idea here is that, say, if Alice gets infected, she's infectious, shows symptoms at day 5, she's already infected Bob, but if she can be traced and isolated at day 7, then the chain is cut and Carol, stays uninfected, even if she is in contact with Alice after that date. That's the fundamental idea behind test, trace, isolate. So as I mentioned, these are part of the Gather Smart application, and the COVID Live report that you saw Neil demonstrate today, a part of our TIBCO for Good program. And I'm going to wrap up and open for questions and point you to a number of resources. Hopefully you were able to follow along. If you go to tibco.com/COVID-19, you can bring up the live report application and do all the things that Neil showed today. If you go to community.tibco.com/COVID-19, that's our data science headquarters. That's where you can download curated data and scripts and so on, and get started with your own Spotfire Cloud application. It's a number of blogs we've written to help walk you through how this works. And if you follow me on social, you'll see a number of posts describing the work that we're doing. We have a few upcoming events with our partners, ARIA, our natural language partner. We have a webinar tomorrow on augmenting visual analytics with natural language generation. You saw the natural language being generated, particularly on the government interventions demonstrations, but also throughout on the main summary page, a number of areas where we're generating language that really helps regular lay people or business people understand what the graphs are communicating. We've got a webinar next week with PerkinElmer looking at epidemiology and genetics on the SARS-CoV-2 virus. And then a webinar later in the month with Syntellis on healthcare analytics, including some of their customers, such as Norton Healthcare and Jacksonville Baptist. But look, let me hand it off to Mike to give us some questions. Mike, what's going on the question front?
Great, thanks, Michael. Yeah, we do have some questions coming in. First one is, it would be really interesting to see the same chart shown side by side, one with super smoother and one with different running or moving averages. So
yeah, I actually have this.
Yeah, I'd like to kind of extend that a little bit to say, if someone is interested in including super smoother in their own analysis, how would they do that?
Yeah, I actually have something I could show, Michael, where I have it actually side by side and have a good visual comparison.
Oh, you do? Okay, great. I was just going to flip to this. In the slides, you'll see this is a link to a YouTube video that Neil produced for our Dr. Spotfire series showing how to do that. But Neil, why don't you bring up what you got there?
Yeah, so as Michael said, there's a YouTube video that will show this. Michael, you can see the super smoother, right?
Yeah.
Okay, so so in this YouTube video, I kind of show there is this blue line. Well, first of all, the bars are the raw cases. This dark blue line is a 3-day moving average. So let me go ahead and put in, let's say, the United States here. So take a look at the United States. This is a little bit easier to see. So this blue line is a 3-day moving average, and this is going to be shifted by half of that, half of the X data points. So this is shifted over by about 1.5 days. And then the red line is this dynamic moving average. So you can kind of see this. The red line is, it's at 4 days. You can see that it's not shifting as much, but it's going up and down. It's really hugging that data. So it's not really smoothing it very well. The artifacts of the reporting inconsistencies are coming through. So you can kind of increase this to get a smoother moving average, that red line there, and that kind of reduces some of the artifacts, but now it's shifted even more. So this is how the simple moving average works. Now the black line here, this is the super smoother. So the super smoother actually looks at, it's going to do 3 running line smoothers. I won't go too into detail, but basically what it's going to do is it's going to look at half of the data points to the left and to the right of every X interval. So every point is going to go and it's going to look at half of the values to the left, half the values to the right, and it's going to do a linear regression. So it's going to kind of do a best fit line. So for half of the lines here, or half the points there, half the points there, it's like best fit line. And it's going to continue to do that. And so you'll kind of get this linear regression that moves through. And that gives you one moving, running line smoother. It'll do that again for 0.2 of the 20% of the values. It'll do it again for 5% of the values. And then it does it again. So at that point, you have 3 running line smoothers. So if you imagine this thing, this black line is actually constructed from 3 other smoothers that it's calculating. So after it gets those 3 different running lines, it then does the whole process again on the predicted values, and that generates this. So a little bit hard to kind of explain. I kind of in the video, I drew it up a little bit. I kind of drew on the screen if you want to know the math behind how that works. But we looked at this. We looked at Loess. I should actually give credit to Prem here. Prem did the heavy lifting on evaluating this. We looked at Loess. We looked at a generalized additive model. We looked at the super smoother. We decided on the super smoother being the best way to remove the noise and reporting artifacts. And you can actually download this and use it yourself. So anywhere in the dashboard, there's a sidebar, and then you go to more resources. There's a link here for the starter template, and that will take you to actually a community page where you can download the DXP, the Spotfire Analysis DXP, and you can download the data functions, the scripts. And there's other resources there as well. I just wanted to mention, I forgot to mention this earlier. All of these intervention data, they are actually captured from TIBCO employees around the world. It's pretty extensive. This stuff is very hard to bring in together with different places, gathering data in different ways, or doing restrictions in different ways, defining restrictions in different ways. So just want to point out that you can actually download this from the community as well.
Terrific. Yeah, thanks, Neil.
Okay, great. Yes, thank you, Neil. So, Prem, the dashboard that you showed with reopening insights, that looks like it's a really useful tool. And I'm wondering, is that available, or how would I get this for a state other than California?
Yeah, so we definitely have plans for this to integrate that into the main application once we get more data in. So the state of California, the state of Washington, and the state of New York, when we researched about this, have publicly available data on what the stages are, what the metrics are, what the thresholds are. And so we're working on that to kind of get all, more data on different states and different countries. And once we have enough data to like build a nice page, we will be publishing that as pretty soon on the main dashboard itself.
Yeah, that's really a great job on that, Prem. And I was just flicking through some of the slides there that we'll make available to you. But the thresholds on these different metrics have been come down through the governor's office and applied to different counties, and the ability to track at the county level all of those and have also mobility data and just understanding how things are coming back to life is really of high value. Mike?
Right. So yes, another question is TIBCO using, or how is TIBCO using any of these applications, either GatherSmart or the Spotfire dashboard? How are we using any of that internally?
That's a great question. I'll take that one. Yes, GatherSmart is in beta at the moment. It's being launched in July. We've already started using it at our own TIBCO offices, and we've reopened offices in Asia Pacific region and particularly in Vietnam, under the auspices of GatherSmart. We have 2 launch customers. I'm not sure I'm at liberty to mention them. I think there's in the press release though, but let me not go there. But yes, we have, we're using it ourselves, and we've got, customers lined up to start using it, and it becomes available after sometime mid-July. And we'll be adopting it as we reopen our offices worldwide at TIBCO. And then, under the TIBCO for Good banner. And the live report that you saw today is also being used, around the world. And Neil mentioned how we had a big effort to collect and collate those data on government interventions. That was managed through our internal Slack channel, where we literally have hundreds of people engaged in keeping track of the live report analysis and contributing those local interventions to the application. So really is a wonderful feeling and a wonderful group team effort across the world as we're able to pull together all those government interventions sort of at a local level from TIBCO staff around the world.
And Michael, does GatherSmart now, does it include any predictive insights? Can those be used as criteria? Does it now include that, or will it be extended to include that in the future?
Yeah, it depends on the basics of GatherSmart. Just the real basics of what is included in the offering out of the box. If people want to extend, the analytics, as a customization on top, that's certainly possible. We've been doing a lot of work in that area. We wanted to make the core application just really simple to adopt. So if people want to do more sophisticated analytics or contract tracing and things like that, that's a customization that we have explored, and we're able to deploy that if a customer wants to go there, but it's not included in the out of the box offering.
Okay, great. And Neil, I think this is one for you. How could I get the databases for COVID-19 in each country?
The database, the actual COVID data sources?
Yeah, the data that you're using in the app.
Well, we have it fairly documented on the first page of our live report. As far as distributing the data, we can't distribute a lot of the data legally directly, but there are some services we can provide, and Michael can elaborate on, where we can provide certain calculations and other data readily available to you. Michael, I don't know if you want to take
Yeah, I can add to that. So if you go to community.tibco.com/COVID-19 to our data science headquarters, that's where you can set up your own version of Spotfire and download our curated data and artifacts like the scripts and so on. But to Neil's point, if you want to go reproduce all the analysis, then you'd need to connect the starter application that we provide you to the data sources that you want to use. Now, currently in our application, we're using Johns Hopkins, our World in Data. At the county and state level, different countries, we are actually ingesting those data from local data sources in the countries that you saw today. So yeah, there's materials that we can provide you, but some of the data you'll have to go and bring in yourself. But you can go and learn about all of that at this site here, the Data Science Headquarters, where we offer our scripts and Spotfire trials and that sort of thing. I think if folks are interested in that, do send us an email. We're certainly open to collaboration. We've had a number of, you saw it today, we featured a number of our partners that we're collaborating with. So if you want to go, deeper than what's available on the community site, we're definitely interested in any collaborations that folks want to get involved with us on.
All right, great. Thanks, Michael and Neil. So one last question. I see we're getting close to the end of the hour here. And this is for Prem. Can you give more details on the streaming data on the flights?
Please.
I think Neil can elaborate more on that.
Okay.
Yeah. Michael, I could share my screen here.
Sure.
Yeah. So the streaming data is in this analysis. It has so there's this kind of live tracker that's just showing the volume of flights coming through. But I wanted to also point out the interactive demo gallery. This is a more comprehensive look at streaming flight data. So this is if you just Google demos for Spotfire, interactive demos for Spotfire, there's lots of things going. There's some various streaming demos that are running constantly for you to explore on the web, as well as even non-streaming demos. But this real-time flight tracker, if you go into here, this will give you a little bit more to play with on the flights that are coming in, including kind of a flight detail where you can select any flight and see kind of its speed, heading, things like that. The way this works is it's all kind of documented here in the last tab. So there's an aircraft that have transponders that send radio signals. And I think just off Amazon, we had an intern here who did a great project who used these software-defined radios. And they use a very inexpensive one. They use a $20 radio receiver. And that is actually going through the cloud in our AWS infrastructure. That's actually transmitting data through the cloud, where we are consuming it from the cloud right into Spotfire for real time. So you can go to this demo and read a little bit more detail if you'd like.
And as Neil mentioned, there's a bunch of great demos on that demo site, that demo gallery site, including applications for I see their oil equipment surveillance and streaming Wikipedia analysis, and we've got our hotspot stuff up there, and I think we might even have our route optimization that I showed today is up there too.
Yeah, I think what's interesting about some of these is you can select these flights and you can see this is real world data. This will take you to FlightAware. You can see this flight just left Boston right now. And it's the same thing on the Wikipedia demo. This is live Wikipedia data edits that are coming in every second all around the world. So it's a little fun to play with and think about how you can apply it to your business challenges.
All right. Well, thanks, Neil. And I see we're right at the top of the hour. So I'd like to thank all the panelists and all the attendees for attending the webinar.
Thanks, everybody.